Good morning, good afternoon, good evening, whatever time you're watching this. I hope that time is wonderful. If you're new here, please remember to subscribe. If you have not, click on the notification bell so that you can get notified anytime I upload a new video. Like and share. If you have subscribed, I am thankful, I am humbled. Please also remember to tell a friend, to tell a friend, to tell a friend. Karibu sana. As you can see by the title of this video, we'll be continuing to talk about my pregnancy journey with my triplets. So I reached at the mark of 12 weeks, and that's when I was supposed to get my cervical stitch, McDonald stitch. Cervical stitch or McDonald stitch is a stitch whereby they tighten your cervical muscle, they tighten your cervix. So sometimes in late pregnancy, if you're expecting multiples, your cervix might shorten and start to open, and you might encounter a late miscarriage or a preterm birth. So to avoid this, doctors recommend you get a cervical stitch or McDonald stitch at 12 weeks or 12 to 18 weeks. Remember, I am not a doctor. I am just talking about my history. If you're expecting multiples, please consult your gynecologist so that you can know way forward for you. So I got my when I was supposed to get my cervical stitching when I was 12 weeks pregnant, but due to an unavoidable circumstance, I was not able to. So I had to travel and come back. So my cervical stitching was delayed to around when I was 17 weeks pregnant. Okay, so when some doctors might recommend an overnight stay, some doctors might do it as an outpatient procedure. That depends with the doctor. As you know from my previous vlog, I talked about Dr. Dagana. So Dr. Dagana does this as an outpatient procedure, and I went early in the, you're not supposed to eat before any surgical procedure. You're actually not supposed to eat anything. So for 12 hours, yeah, I think 12 if I'm not wrong. So I had not eaten from around 10 to 8 in the morning. So I went in. My cervical stitch was done at Upper Hill Medical Center. There's a clinic there. I don't remember. I think it's on second floor. So I went in the morning, but Dr. Dagana had an emergency, so he will not attend to me that early in the morning. So I had to stay there. I will not leave. The nurses and the doctor did not allow me to leave because they said if I leave, I might be tempted to eat, which my procedure might not happen that day. So they kept me there. They gave me a glucose drip, so that I don't feel hungry. Remember, when you're having multiples, hunger is real. So after that, I was given a drip up to around 4. He came in. I was wheeled to the theater, got my cervical stitch, and back to the recovery. It took less than 30 minutes to get the cervical stitch, and it's damn painful. I'm telling you, it's so painful when the anesthesia wears off. It's so painful. Cervical stitching, what I had googled and watched YouTube channels about cervical stitching. What they do, they pull your cervix down, then they take a string, they tie a string round, and tighten it so that your cervix will not open. Even if the babies will become too heavy, the stitch will be able to hold them in and not let them out. So that's the main reason why a stitch. And remember, I did not have any, my cervix was still closed. I had not had any previous miscarriage or anything, so it was not like something that was going to happen, but just to be safe than sorry, I opted to do the cervical stitching. How much it costed me? Okay, that it was so expensive. That's my view, because if you go to a public hospital, it's much cheaper. Even if you have your own doctor, I don't think you'll spend over 30,000, a maximum of 35 if it's a public hospital. If you have your own gynecologist, maybe you'll spend that 35. If you don't have your own gynecologist, it might be cheaper if the cervical stitching is done by a resident doctor of that particular hospital. It will be much cheaper. If you have your own gynecologist, as I said earlier, might be a little bit higher, maybe around 35 going up, because I did ask about this. And for me, I went to a private clinic. I had a private gynecologist, so it costed me a lot. It costed me around 80,000 Kenyan shillings just for that 30-minute procedure. But it was I believe it actually saved my babies, or I don't know, I just want to believe it actually helped, because I did not experience any sign, as I said earlier. So if you're expecting multiples, please consult your gynecologist about cervical stitch before you turn 12 weeks, so that you can plan on getting it, because they say if you get it later, you might get a miscarriage, or yeah. So please consult your gynecologist. Cervical stitching, does it cause miscarriage? I'm not sure about this, but I might say it might cause or it might not. So they give you tablets. They give you tablets to insert down there to prevent miscarriage too. Yeah. So I was given tablets to insert there for a whole week. Was it all or 3 days? I really don't remember. Around 3 days to a whole week. I was given bed rest for a whole week. So you're not supposed to do. You're supposed to be on bed rest. You're not supposed to do a lot of manual work, a lot of walking around, just rest. This is the perfect time. If you have not paid for Netflix, please do so, or Showmax or whatever, so that you're kept busy on your bed. So I was given a bed rest for 1 week, and all went fine. Though I just bled a little. It was not too much, I think, for 2 days, and then it was gone. Yeah, so only that. So cervical stitching is very important if you're expecting multiples. But before you decide on getting this, talk to your gynecologist. Some gynecologists have no idea what that is. Some do have an idea what it is. Some might not recommend it. Some will recommend it. So consult your gyna. Okay, after that, so that I was around 17 weeks. So I still continue to see Dr. Dagana for quite some time, and then I started to hunt for a hospital. Nairobi hospitals are so expensive. I do not have an insurance. That's one reason being. I do not have an insurance. It's because I relocated back to Kenya the same year I got pregnant, and when I tried to find an insurance cover to cover my maternity, most of the insurance will tell me they do not cover maternity until a certain period of time elapses in insurance, and most of them will go for we cover maybe after 9 months, 1 year, 1.5, or 2 years. So I actually looked for insurance company, but I will not find one that will cover maternity just at a go. So what I did, I updated my NHIF status, because I had not paid for the last 5 years. So I had, okay, as I was saying, I updated my NHIF status, so that's what helped. So my search for hospital, I went to various hospitals. I went to Kenyatta Hospital, I went to Aga Khan Hospital, I went to Avenue Parklands Hospital, I went to MP Shah, I went to Aga Khan. Have I said Aga Khan? I don't remember. I went to, there's this hospital, what is it called? Forgotten the name. If I remember, I will tell you. I also went to that hospital. I went to the one in Kasarani. What is it? Nemawai. I went to Nemawai. I went to Plainsview. I went to so many hospitals trying to find a hospital that is not too expensive for my delivery. Most of the hospitals that I found were they were pretty expensive, and so I found when I went to Mpisha only because I'm a CS person. I got my first one through C-section, so definitely my triplets were going to be through C-section. So my Mpisha C-section will cost, when I checked, I don't remember the exact, but it will come to around 300,000. And remember, if you're going with your own gynecologist, also there is money to pay the gyna. So around that figure with your own, I think with your own or without, most of the Mpisha was around that. Kenyatta was a little bit cheaper. Kenyatta, I think, was around the private wing was around, I don't remember, but it was not that, Kenyatta wasn't that expensive, but it was fair. But also it's Kenyatta, so but private wing. I went to Aga Khan, also quite expensive. We were talking about 300,000 going up. Avenue was a little bit cheaper because it was 200 and something around. It was not yet 300, but it was almost, but it was not 300. I went to the other hospital, Nemauhai. Their offers were great too. Most hospitals are expensive. Some, their offers are great, but now the problem came in. I was also supposed to check on their NICU. That was also something that I had to check when I decide which hospital I am going to deliver at. Reason being, my babies are not going to go to full term, that is 40 weeks, because they were multiple gestation. Most triplets are said to be due at 32 weeks. And 32 weeks, that means it's 8 weeks earlier or 2 months earlier than the expected delivery time. So when I was searching for hospital, I needed to look for a hospital that is going to cost, the NICU is not exaggerated or it's not too much for me since I was paying out of pocket. So most of the hospital, the NICU, the cheapest one that we got was Kenyatta Hospital, which was the cheapest that we got around Nairobi. It was Kenyatta Hospital, which was 15,000 a day for one baby. So that is the nursery in case your baby goes to an incubator or needs a ventilator and all that. So I needed to look for all these things before I decide which hospital to go. So Kenyatta was my option. But now the problem came out, like, it's not, most people are referred to Kenyatta, so it's not guaranteed you might get an incubator or you might get a ventilator machine if your kids are too early and all that, because most referrals are done to go to Kenyatta. But although they give first priorities for people who have given birth at Kenyatta Hospital, but still your baby might end up sharing an incubator with another one. That's what I was told. Your baby might end up sharing an incubator with someone else. That's, yeah. A ventilator might not be present at that particular time, and so many factors because of the high population of people giving birth at Kenyatta Hospital. Two, so it was cheaper. So they will say it was 15,000 a night for the baby to be in the NICU, maybe in the incubator or the ventilator machine, and also it might go higher depending on what kinds of drugs the baby is being given. So me, when I was looking for a hospital that is going to cater for my C-section, I'll also have to focus on what their NICU provide. So that was one. So MPSHA, their NICU was around 25,000. If that is my baby had to go to a ventilator or incubator, I think it was 25 or 30,000. Aga Khan the same. That's per night. And remember, I'm having 3 babies. If all of them had to go to an incubator, that's 90,000 a day. And once a baby goes to the NICU, as they say, they're given I think 24 hours or 2 or 3 days before the doctor can say it's okay for them to be moved to just a normal nursery. So if you calculate that, most of the hospitals I was checking, that was the price range in Nairobi. Another reason I did not pick like NICU, which was so cheap and so favorable, because C-section was around 45,000 that time I checked. But now the problem was they did not have a NICU. So if my babies were born with any condition, they will have to transfer them to Kenyatta. So you see, that's why I did not pick NICU. When I went to Avenue, I said it was among the cheapest. I had actually, when I checked that, I had considered, wow, this is cheaper, so I might end up settling for Avenue Parklands. And what happened is they only had 2 ventilator machines. I don't know if they've added, but that time they had 2 or 3. I think 3. And by that time, when I was asking about the NICU and what the machines they have, they only had 2 which were not being used, but 1 was being used. I think they had 3. So when they told me they only have 3, and I was like, what happened if all my 3 babies needs to go to the NICU? They said, now we will have to transfer 1 to Kenyatta or to a hospital of your choice. And hospital of my choice means Aga Khan or MPSHA, you know, those hospitals that are around the area, or Kenyatta, you see. But now those were expensive. NICU at Avenue was around 25 or 20, I'm not so sure, around that price. So that's why I did not pick Avenue, because they had only 3 ventilators machine and I was expecting 3. So I told myself, what if when I deliver, the 3 babies needed a ventilator and there's another one already in a ventilator? So that was also a no-go zone. So when you're planning to, when you're delivering multiples, when you're researching for a hospital, please find a hospital that covers all this. Your C-section, if you're not paying with insurance, your C-section and all that. And also look out for the baby, the NICU, because it's also it's very important. Because if you go to a hospital that cannot handle preterm babies, then you're risking your baby's life. So please, when searching for a hospital, look for a hospital that is going to cater for NICU services. Thank you so much. Thank you for watching. Please stay tuned. We will have another vlog coming up soon about my pregnancy journey with the triplets. Thank you and bye. If you've not subscribed, please do so by clicking the subscribe button. Remember to tell a friend, to tell a friend, to tell a friend. Bye bye.